Today we are going to discuss about the OET writing and specifically the marking criteria. So this video will be focusing majorly on 3 basic marking criteria, although it will not be a detailed video, but to give you insight. Even if you have 5 days left for the exam, if you have not have any basic problem in your writing grammar, then this video will really help you to crack your exam in 5 days. So to begin with, as you know that we have 5 minutes time for reading of writing task. In this time you are not allowed to write anything anywhere, followed by 40 minutes time to complete the letter. So in total we have 45 minutes time. You will get a profession specific task. If you are a doctor, you will get medicine role. If you are a nurse, you will get nursing role. Pharmacist will get pharmacy role, and so on. So to begin with, 3 criteria. The first one is the purpose of writing. The second one is your content, and third is organization. So first of all, like 90% of time there will not be challenge of purpose, but if there is a challenge of purpose, that is a killer thing. So where we can identify what is the purpose of writing. So bottommost part of the writing task, whenever you go to the writer, if it's a referral notes, discharge, transfer, and so on, just go to the bottommost part, identify 3 things. Ask yourself 3 questions. Who is the audience to whom I'm writing this letter? Let's say I am a doctor, general practitioner, I'm writing this letter to the cardiologist. So put yourself in the shoes of cardiologist. Now see the letter from the eyesight of the cardiologist. If I would be cardiologist, how would I need that particular information, in which order? Second thing that is important is your reason of writing. If you have assessment, right? Even if it's a discharge letter, so what is the reason of discharge and why we are discharging the patient? If it's a transfer letter, why we are transferring? If it's a request letter, what is the reason of transfer? So you will be able to identify this information in the bottommost part of the writing task. So third thing is what do you want. Normally for what and what do you want is commingled, like it's same. However, sometimes we have to identify. If your focus of writing is clear, 90% of time that you will be able to clarify this exam with no hesitation. I have not seen any healthcare professional till this date that you will be confused in selection of the case notes. But yes, organization is a challenging thing. And why organization is challenging? Because we try to find an easy pathway for us to pass the exam. Just follow the model answer. Do not follow the model answer, please. I would request time and again to the students. You can see the model answer for the vocabulary, for the sentence structure, for the composition, but not for the organization. Because this could be the possible reason for failure. Organization means where to write which thing. Again, reintegrate. Where to write which thing is heavily dependent upon the person to whom you're writing and the issue for what we are writing. I hope if you have a clear focus, you will not fail this exam. So this video have a small tricks and tips for you to understand the organization, irrespective of case. I have not incorporated a case, just one example that I have given you for the referral. But organization, again, why we are writing and what we are writing, and accordingly sequence this information. So 3 criteria for purpose of writing, in which to whom we are writing, for what we are writing. According to those person and issue, you have to select the relevant case notes. We have relevant, semi-relevant, and irrelevant. As a matter of fact, do not select irrelevant case notes no matter what. Candidates select their irrelevant history just because of the number of words. Second thing is the semi-relevant information. A pro tip, if you join M&M or not, but for all of you, a pro tip is never ever write down semi-relevant information above relevant. Why would you do that? Because you follow the model answer. In the model answer of maybe some letter that might be right, they have written social history right after introduction, and you just blindly follow that structure, write down social history after introduction, and that social history would be semi-relevant in that particular scenario. You are going to fail this exam. So a pro tip for you, that never ever write down semi-relevant information above relevant, number 1. Second thing is in organization, that is always summarize the less relevant. I'm not saying semi-relevant or irrelevant. I'm saying that once you put the filter of relevant, so always summarize the less relevant detail. For the sake of example, if you can see, if it's a referral letter, we have progression of disease, 3, 4, 5, 6 visit, and then last visit we have the acute symptoms. So these 2 to 3 visits should be summarized, and acute visit has to be expanded. Similarly is the case with your discharge letter. Whatever happened in the ward, right? If it will be a lot of information, just concise them down. Conciseness does not mean to omit anything important. Conciseness means to give an overview about the important events. If you have a nursing management or rehabilitation plan, again, you have to summarize them down, but less summary from your ward. And lastly, we have a discharge plan we have to expand. So there is no ideal structure. Sometimes we have a situation that in first 3 visits there are some other diseases and then we have other diseases. So we will bring them up. Candidates have a focus, okay, no matter what we have to write urgent referral letter and today visit should always be up. This is not the case. Sometime, lastly we were discussing a letter when they were having an ECG finding in the first visit, and in the last visit we did not have something important. So they have put the last visit at the first place. It will break the coherence and the organization. So I hope this quick discussion of mine would somehow help you to understand about the organization letter. Thank you very much and stay tuned with us for other videos.